I want to go home. This is a common symptom that family members bring up in dementia consultations, where their loved one who's having memory problems will repeatedly say, I want to go home, take me home. And the family members are really confused because what they're talking about is a home that probably does not even exist anymore. They are mostly talking about their childhood home. And because it doesn't even exist anymore, how do you even deal with the situation? So first, let's kind of figure out why your loved one is experiencing this symptom. So there are primarily two reasons for having this symptom. Number one is that, especially when we have our memories affected in diseases like Alzheimer's disease, your newer memories get erased. So say if this is my life and I start forming memories at some time right here, and this is where I am right now, the memories that get affected are the newer memories. And you kind of erase your memories backwards. So very often, if you have a family member with Alzheimer's, you'll notice that they talk a lot about their childhood, their marriage, the early times. The reason being, those memories are really good and intact. And the memories the more recent memories are the ones that are being mostly affected by the disease. So number one, your loved one probably does not have a very good memory of things in between. They have good early memory, so they do tend to talk about things that were really in the past, and their house being one place that they remember very well. The number two reason that this happens is home, especially your childhood home, is often the place where you feel very safe. And when our family members with dementia and memory problems, when they start experiencing any kind of discomfort, they might not be able to clearly verbalize it, but they may say things like, I want to go home. And that might be a sign that they are uncomfortable due to some reason. So, say you have a family member who says this to you. What do? You cannot just take them to their childhood home. So a common behavioral method that we follow for any individual who is having a distressing symptom due to dementia is we say validate, reassure, and redirect. So let's start with validating. Oh, Mom, you're missing home. That's terrible. Do you miss your family? That's just saying, I understand. I see that you're missing your home. And you just say a very simple question, such as, do you miss your mom? Do you miss your dad? Or do you miss your family? And they might be more open to talking about what they are missing. We do recommend not asking very open-ended questions like, what do you miss about your home? Because that's a lot of cognitive thinking. And as I just said, maybe your loved one is experiencing some kind of discomfort and maybe they're just verbalizing, I want to go home to feel more safe. So primarily what we want to do as the first step is validating. Oh, that is difficult for you to miss your home. I guess it should be very difficult. So you can even leave it right there. Now the next step is when you say reassure. That's when you say, I'm with you. I'll be with you. I can take you there. That's your reassurance. I'm with you. You can say other things like, you're safe. You're with me, Mom. The last part of this behavioral management is where you say redirect or distract. And oftentimes in my other videos, you'll notice that I'll say things like eat a snack or go for a walk or do other activities. But for this specific problem, I want to go home. Your loved one has expressed a will to be out and be moving, and they would really appreciate if you combine this with some kind of physical activity. So if you say, oh yes, let's go home, you step out of your house and you take them for a walk around the block, come back, stand in front of your house, the current house, and say, we're home, Mom. And by the time that they took the walk, some of their nervous energy got out. And when they come out and see your house and they say, oh yeah, this is house, this is my home, and they will enter. Sometimes some of the family members have even told me that they will take their loved one for a little drive. They'll say, okay, well, if you want to go home, let's hop in the car. And they kind of drive around. They go places, maybe visit a cafe, drink coffee, and then they come back home and they say, we're home. So this often helps our family members because, first of all, when they come and see the current place that they're living and you orient them to say, well, this is home, they will get oriented to the new place that you bring or the current place that they're living. And secondly, it does get out the nervous energy. If all of this doesn't help and you're seeing that there's a lot of this repetition of I want to go home, I want to go home, also try to see, is there anything that is uncomfortable in their environment? And that is why they're seeking safety or comfort. So is it that their clothes are too tight? Is it that they're constipated? They have urinary retention? They have some kind of infection, a UTI going on? Are they in pain? Are they not feeling well? Is there a recent medication change? So when the simple behavioral changes do not help, also try to think, because this is often associated with the feeling of comfort and safety, kind of reason out if this three-step process of validate, reassure, and redirect does not help, then say, okay, what is going on in the environment? What are the triggers? When are the days that mom is more likely to tell me she wants to go home? What was unusual about that day? And how can I, in future, prevent it? So hopefully this was a helpful video. I see this very commonly in the clinic and very often when I tell my families that it is as simple as just taking a walk around the block and coming back, they really appreciate it and it truly helps the families. So I'll see you back in the next video. Till then, take care and goodbye.